Hey, everybody. Welcome to Pillosphy, a production of the Counseling Center in Portsmouth, Ohio, one of the first and most widely affected areas of the opioid epidemic. I am Senior Director at the Counseling Center, Max Lyles, here today with guests Theresa and Jonothan. What's up, guys?
Hey, Max.
Hello.
Doing well?
Nice to be here.
Yeah. Glad you guys are here, man. Today we're going to touch on the need really for community mental health providers, some do's and don'ts when accessing services, and give some advice about kind of what we are looking forward to doing. I know, like, since COVID has kind of let us all out of its grips and back into the community, and even through that whole process, mental health was like a big buzzword that people were being encouraged to take care of themselves. You even wrote a little bit about that once upon a time, right? But before we get into that, I always like to qualify our experts. So, Theresa, if you want to start, tell us a little bit about just what you've done in the field, what your experience has been, how you got involved, whatever you want to tell us.
Okay. Well, my name is Theresa Bryan, and I have been at the hospital for over 33 years at SOMC.
I haven't done anything that long.
Yeah, I know. You guys are babies, but that's okay. Anyway, I am the director of social work. I also work very closely with our emergency department, and I work with our hospitalists. Within the social work at SOMC, we have social workers pretty much everywhere, in hospice, at the cancer center, in the inpatient units, in the ER, in home health care. I think that's it. And really, they're there to help coordinate services, assess mental health needs, assess substance abuse issues, anything that really is a social need that patients might have, whether that's paying for your medicine or finding a place to go if you're homeless, or finding a treatment facility.
Yeah. So how did you get involved in the social work profession yourself? Give us that little tidbit.
Well, I got involved on a fluke, to be honest.
Me too.
Same.
My sister-in-law came up. I was working at a nursing home, and I was doing secretarial work, and I was going to be a teacher. And she came up and she said, "I need a social service designee. You would be good at that." And this was way, way back.
Turns out she was right.
In the middle 80s. So I took a home study course because they didn't have computers back then, and on what is social work in a nursing home. And I fell in love with talking to patients and finding out their histories and all of that. And so I switched my major, and then I worked with the folks at the hospital a lot through the nursing home. So I went to the hospital, and I love hospital social work. It's by far the best. It's got everything, any kind of social needs that is out there, can be found in the hospital. If you think about it. So it's a great place to practice social work.
Absolutely. Well, cool, man. Yeah. We're super glad you switched up. You switched up and got gang affiliated with the social workers, right?
Yeah. I think the region is lucky that you made that decision.
Yeah, for sure. Yeah, you're totally a staple in the social work community down here. I hear your name all the time. You need to talk to Theresa.
Yeah, good and bad, probably.
Hey, man,
it's from Jonothan.
Well, it's our production. We can tell whatever stories we want.
Whatever.
Right? Yeah. Yeah. Anything else you want to add in the bio, Theresa?
That's what I got my master's from University of Kentucky, and LISWS, which is just a licensed social worker.
Yeah.
And I also do a lot of ethics work. I got my ethics certification a few years back, and so that's fun at the hospital. There's a lot of ethical things that come up, and I enjoy that a lot too.
Cool, man. Hey, again, thanks for coming. And to the other side of the table, Jonothan Brashear, Director of Mental Health Services at the Counseling Center. Give us the biography, man.
So I moved to Portsmouth, Ohio, when I was about 13, and
immediately became a social worker.
Just immediately, yeah. When I got there off the bus, they gave me a social work license, and. No, so just kind of grew up in a transplant family. Mom was originally from the region. Dad's from New Orleans, which is where I originally lived.
Okay.
And came up here and went through high school and was looking for a job, honestly.
That's one of my
out of high school.
favorite stories.
Just looking for a job.
And tell the story about the job you applied for that you didn't get.
So the Counseling Center had a posting for a receptionist or clerical work part-time.
Sure, yeah.
And the BP gas station had a posting for a I don't know what you call it, a gas station attendant. Yeah. And so I interviewed for that job, and then I interviewed for the counseling center in that entry-level position. This is about 15 years ago. Back to back, really, like one day after the next.
And whoever calls, that's where I'm going, right?
Yep, just hoping to God that I get a job. And the BP did not call, and the counseling center did. So, and honestly, like that's been one of the best things that ever serendipitously happened to me.
Totally changed the trajectory of your life.
Absolutely. So this is kind of ground floor of the medication-assisted treatment induction for the region. The counseling center had very recently opened up a family health care center, and they were providing a Suboxone intervention for the community outpatient and residential programs. Yeah. So that job as a part-time clerical, that lasted about 9 months, and then Andy Albrecht, our CEO, hired me to be the outpatient case manager.
He was director of community outpatient at that point in time?
Yes, he was. And so he was my first clinical direct supervisor, which is something I like to brag on internally, if I have to.
Little clout. Little clout.
So, we started up a community outpatient case management program, and that kind of grew into working with the medical clinic and doing case management for the medication-assisted treatment program. And
driving out to South Webster and picking somebody up if they needed a ride.
Absolutely. And that was one of the more fun jobs I've actually had for the agency. It was a good time helping people access care. And so just kind of organically through that, I was going to school at Shawnee State for a completely unrelated degree, and I met Scott Douthit, who we talked about a little bit earlier. Yeah. And wound up deciding, I think that social work might be something I'd be interested in. And it's just kind of been a lot of blessings on top of the next since that time.
Yeah, it's in your blood, man.
A couple years ago, I had the opportunity to reorganize the mental health services for the agency. And I'd worked, in the interim, I'd had a few other positions, assessor, individual counselor. I did coordinating for 2-5 and worked a lot of my time at the crisis center. Yep. And so today I'm the director of that program, which is really cool.
Yeah, totally awesome.
And got to meet Theresa. So.
And then so I don't feel left out. I'm also a social worker. I just have this desire to fit in with the group, right?
Wanted to be like
also a social worker. I wanted to be like you guys. Talking about Scott, social work as a profession, one of the first place that I'd ever heard that mentioned in the college setting at Shawnee State. And thought, man, I wonder what that would be like. And then fast forward a few years, I wound up in school and doing the same thing. So, and then also too, there's some, you guys have like wagers on staff trading or things. There's some people on the trade block and things like that. We've got some different talks we're going into.
Yeah, I yelled at Jonothan because he took somebody from us in the ER, but I had no clout because he did his practicum in the ER with us. Yeah. And I tried really hard to recruit him to the hospital. So he knows that. Yeah. So I know he knows that. So he's like, you can't talk. And so I try to behave. But no, people, they want different things. And a lot of times they'll be at the hospital and they'll like that to do that for a while. And they want to get into straight outpatient or something. So we wish them the best. We really don't hold any grudges.
And one of the reasons I decided to be a social worker is because I had no clue what I wanted to be when I grew up. And I knew that I'd have options this way. Like you said, there's a social worker in everything in the hospital. There's a social worker in every program at the counseling center. Yeah. Get to work with a lot of, So if you're watching this and you want to be a social worker, boy, do we have an opportunity for you.
We do. And the cool thing about social work that I love is that we really believe in the systems theory, which people don't realize that we believe in helping you with your counseling, with your depression and all that. But we also believe the housing is important and a job is important. That you can't, it's a little different in that holistic person that we want to help. Yes. And so it's great fun. I've been doing it, like I said, 30-some years, and I still love it. I still love when I get to go be a social worker and see patients. It's just a lot of fun.
Yeah. So talking about some of that systems theory things and sort of the things that we are looking on and leaning on to help people kind of navigate, there's not a social worker in every department at the hospital by chance, or there's not a large group of counseling center employees that are social workers by trade by chance. Like there are community needs that need addressed, right? So from your guys' expertise and your experience in the field, what are some of the things that you've seen in your careers that needed taken care of and addressed for individuals? And then how has that changed within the last handful of years? Whoever wants to start.
Go right ahead.
Well, I think when we first started, we were on call for the ER. So we would just come in as needed. And now we have overlapping 1 to 2 people from 7 a.m. until 2 a.m., 7 days a week.
Wow.
And they stay really, really busy.
Wow.
And part of the reason is that there are options that we can offer to people.
Sure.
So, we see really anything that you come to the emergency department for, if it's a mental health crisis, if it's a substance abuse crisis, an overdose, whatever it may be. Our goal is, if we can connect you into treatment, that's what we want to do. Mm-hmm. And that's how Jonothan and I work very closely, because sometimes patients just need a little bit, they need somewhere safe to go until they figure out what they're going to do, whether that's inpatient. And the counseling center has grown so much. I mean, it's been growing forever, ever since I've ever heard of it. It's always expanding. But the addition of the foundation and all the things that they do, and the expansion in the crisis unit and what they're able to do, and day one, and all of the things that we can offer. I have Jonathan's number on speed dial, and it's nothing.
You're on the favorites list, man.
Oh yeah, and if we have a patient and we need, absolutely, if we have a patient that needs to go somewhere and we're struggling to find an answer, we can coordinate that, and I think that's really important. And Shawnee Mental Health is also involved in that.
Absolutely.
They have the
that's
on-call
another
person.
legacy program.
Absolutely.
When you're talking about local community mental health stuff, Shawnee Family Healthcare, absolutely like a staple in the community.
Yeah. So all of us working together, and it really does take all of us, I think, to help. There's so many patients. You never really have to worry too much about us and being in competition, because there's just so much work to be done.
Well, also talking about, the systems theory thing, right? There's all these different holistic things that we need to do, and there's also different parts of the system and infrastructures in place that have specialties to take care of certain things. And the goal is, you're talking about your social worker schedule overlapping. The agencies also overlap at certain parts to try to provide the best care for people.
Right, absolutely. And of course, the hospital, our main thing is to just make sure when the counseling center sends us a patient, just to make sure that they are safe to go back to wherever environment, whether that be to one of your group homes or the crisis unit or foundations, that the docs have checked them out and they feel like they're medically safe, and we coordinate that. But it's been a huge help.
Sure. What about you, John? Things you've seen, the way things have changed. What do you got?
I think things have changed quite a bit in a very positive direction over the last several years, especially. One of the first things that I personally got to see, like kind of from a community assessment, and then especially the counseling center, like enacting a program to address, would be like the resurrection of the crisis unit, which was a legacy program through other agencies, and we just didn't have in this community for a few years. And with that, of course, is like the 1010 crisis hotline, 354-1010. That's been a number in this community for folks that need help for decades and decades.
Yep, 24 hours a day, 7 days a week, 365 days a year.
Yeah.
You call that number, and somebody's going to answer within 3 rings.
Absolutely.
No matter what. Yep.
So back in 2014, the counseling center was approached by the Adamus board and had the opportunity to bring back the crisis center, which is a 10-bed non-medical residential facility for an individual that's experiencing a substance abuse or mental health crisis here in our area. Completely regardless of funding, other circumstances. If you're a resident of Adams, Scioto, or Lawrence County, like, you have access to the crisis center, providing that you've been referred by a medical or behavioral health provider. So that's something that in this area where we talk about community trends, opiate epidemic, mental health crises, even coming out of COVID-19 with the mental health problems that we see rising from that, is just vital for the social and emotional health of a community, as a place for someone to go if they can't be in the environment that they're in, but they don't necessarily need to go to a psychiatric facility.
Right.
So seeing that kind of reenacted and re-implemented and getting to work on the ground floor of that was really where, I think, for me personally, the social work became less of a concept and more of something I got to see happen for people.
Yeah, I feel that.
And then just watching as that team that all work extremely diligently. That's a 24/7, 365 program, just like the ER. Christmas morning, there's someone cooking at the crisis center for the clients that are there. You know what
somebody's
I mean?
perking a pot of coffee up
Absolutely.
Right now.
So with that, last year we start to notice, again, and I definitely think that the pandemic would play a role in this.
Absolutely.
folks need something that's a little bit more long-term. The crisis center being, there's no minimum or maximum length of stay for that program, but the expectation is that it's a crisis and you're trying to resolve that in a relatively short term and help the person get on their way. So when we started being confronted with cases and challenges that didn't necessarily have that quick resolution, the counseling center got together and we decided that we were going to actually expand on the philosophy of that program, open a medium to longer term care home for those folks. And we've just steadily been putting that together with OMAS, with the state over the last several months, and seeing that come together for the region just as, and in typical counseling center philosophy, just something that we don't really have a local framework for. We're just going to figure out how to do this ethically, properly, and well has been just a huge blessing. So I think it's long, to give you a long-winded answer.
Well, no, that's perfect. Man.
I think that just seeing the need for, like Theresa talks about, the systems, like that housing piece, that medical piece, the clinical piece that is vital to that, and just bringing that all together into something new. And that, to me also, that's really what social work's about, being creative.
Being creative to meet the need, and the counseling center has done that over and over, just continues to do that, which is so appreciated for our community, because there really wouldn't be a place for patients to go, because the psychiatric units, everyone doesn't qualify for that. But they honestly aren't safe probably going back home at that moment. They just need a little bit of a break from their whatever situation they're in to figure out what they want to do. And it's really helpful.
And everybody, there's like the different roles and responsibilities of the hospital and the crisis unit and the longer term care facilities. Turns out that most crisis situations, or, where a person needs to access those kind of services, some of these are really complex. It's not an open and shut case, so it's like we need time to work through those things, and everybody has sort of their specialty. So talk a little bit about that. Like, when is it appropriate to try to access hospital services for certain things, or what are some of the things that you guys are seeing at the ER?
Well, at the ER right now, I think our biggest concern, our biggest number of patients that we see for any kind of mental health or substance abuse is patients that are on methamphetamines and really struggling with that. That takes a while, and it's very frustrating for families and others that really would like for us to send them directly to a psychiatric hospital. We would love to do that. If we could get anybody in the world that would take them, we would, but they really aren't willing to do that until they that's out of their system, and that can take days sometimes. And so we keep them and keep them as comfortable as we can. And then once they've, kind of got that out of the system, hope that they are willing to get treatment. And if they are, then that's when we call you guys in. But really, any time before that, they can't go. And that's probably the biggest struggle that I wouldn't say struggle, but it is a definite need that we don't have a place that they could go to come down off that meth, but they really do need a physician pretty much that whole time because of the medical complications that they could have. So the hospital is appropriate, and I think if somebody is suicidal and they have they may call the hotline, but if they need treatment in the middle of the night or any time, the hospital is sometimes the only place that you can go, and especially if you've had an overdose or you've done something like that, you want to get to the ER as quick as you can, call poison control and head out to the ER.
Yeah. And that's like talking about those like ever evolving needs of the population, people with mental health disorders and just like the population in general. It's like the symptomology changes, drugs change, the way that people use drugs change and all those kind of things. And it's like, being there within the social workers within the systems to navigate. It's like, well, this doesn't necessarily fit in this round peg doesn't fit in this square hole, but this is all we've got right now is just to like hold kind of where we're at. Right.
Yeah. The other thing that's great that you guys do mental health, because there's such a, that mental health and substance abuse go hand in hand.
Oh,
so, for a while, maybe when I first started, it seemed like it was much more separated. These guys do mental health, but they're not going to do any substance abuse. Right. These guys are, and now pretty much everybody's come to the conclusion that they're going to have to do a little of both.
When I talk to studying or new social workers, that's something I like to hit on, is that you might have a job in a nursing home or in some sort of community access program or whatever. But if you're a social worker, like you are going to work with the substance use population, you're going to work with the mental health population, because that's a primary stressor for people. Really, I think across probably the country, but especially in an area like this that's been through its economic ups and downs. And
it is our population.
Yeah, it's the people that we serve.
It is. So if you want to get to help people, it's a great profession to do. I mean, because there are so many needs, and you can make a difference, and that's what's really cool when you really feel like that you've helped somebody, even if it's just that one time in the ER that maybe you've instilled hope. Or is it Social Work Month? Are we trying to recruit people to be social workers?
We might trying to recruit people to be social workers.
Yeah,
me too.
Every month, Social Work Month.
Social Work
Every month,
Month.
Social Work
Please
Month.
be social workers and come to SONC.
We'll drop the job registration link in the comments.
It is Mental Health Awareness Month, though.
It is.
I think
that is good. And we do have some outpatient mental health there. Yeah. We have our outpatient psychiatric nurse practitioners, and I think you guys have some of those. And there's a few in the county that we have, so that's great.
Yeah.